Hello, it's Dr. Cindy with this week's Mental Health Moment. Today I'm going to talk about healing. I'm sure everyone at one time or another has experienced a scrape or a cut of some sort in the course of daily life and probably on multiple occasions. Whether it's an abrasion from falling on the pavement, a slice to the skin while cutting vegetables in the kitchen, or the more significant wound that occurs from a surgery, our body sustains injuries of varying degrees as we make our way in the world. Although this is never pleasant and certainly something we prefer to avoid, it happens with enough regularity from a very young age that we learn fairly quickly not only that these experiences hurt, but also that with the appropriate time and attention, our injuries heal and the pain goes away. Note that I said healing requires both time and attention. The expression time heals all wounds is not entirely accurate. While the body has an amazing capacity to take care of itself, we facilitate that process by, for example, washing out a cut, applying pressure to stop the bleeding, and bandaging the area to protect it while it is in such a vulnerable state. Depending on the severity of the wound, more extensive intervention like stitches may be required. In general, very superficial injuries require little attention from us to get better and heal quickly. But the deeper the cut, the more we need to do to facilitate the healing process and the longer it takes for the body to fully recover. But we can tell that the healing has already begun when the bleeding stops, and we can see the progress as the scab develops and later falls off, and eventually the affected area appears as good as new. For physical injuries that aren't visible, like a strained muscle or a twisted ankle, we rely on the pain to give us clues as to how the healing is progressing. If something still hurts, we know it hasn't healed yet, and we do what we can to protect the injured area and not do anything that might re-injure it and prolong the healing. We might even apply ice or heat or massage it or stretch it out in service to relieving the pain and helping with the recovery process. And we intuitively do things to help minimize the pain while we are waiting for it to heal. Some injuries are so extensive that there is additional support and extra time required for them to get better. A broken leg needs a cast, and no amount of wishing or willing the bone to heal faster makes that happen. We recognize and accept that the cast is a necessary support to facilitate the healing process, and we are willing to keep it on for as long as it takes for the injury to get better. If taken off too early, we risk the break not healing properly. Even after the cast is removed and the bone has healed, there's often a need to give attention to the muscles that have atrophied from lack of use. There is work required to gradually build the injured leg back to full strength. And I have yet to hear of anyone who has asked their doctor to remove a cast before the bone has healed or to take out stitches when the wound has not yet closed over. We tend to accept that our body will heal in the time and way that it needs to, and we have confidence in its ability to do so. So we are usually willing to tolerate the pain, discomfort, and inconvenience of our physical injuries, knowing that with enough time and care, we will fully recover. Now, I've spent so much time talking about physical injury to contrast this with how we tend to our emotional hurts. Feelings are primarily a bodily function with their own process for healing, but we react to them very differently than we do physical pain and often don't do the things that would facilitate them getting better. When we experience emotional distress, we just want the pain to go away and don't tend to see ourselves as agents for actually healing the hurt. As I've talked about in other videos, that happens because we often aren't taught as children the importance of our feelings or are shown how to take care of them. So we learn to suppress them, distract ourselves from them, and keep them to ourselves, leaving us with the impression that difficult feelings are to be avoided at all costs because when we have them, it hurts and there's nothing to make it better. So when it comes to emotional hurts, we often don't give them either the attention or the time to help them truly heal. If these are related to unresolved difficulties from the past, they have been overlooked and neglected for so long that we may continue to experience the emotional pain of them without even realizing where it is coming from or what it is about. So we make the mistake of attributing our distress to current people and situations in our lives, and we focus on what we can do to improve those external relationships and circumstances rather than our internal hurts. Or if we can't identify something in the here and now that seems to be causing our challenging emotions, We often say we have no good reason for being upset and then end up feeling frustrated with ourselves or guilty because we don't think we should be feeling that way. I call that kicking yourself when you're down. When physical hurts arise, we don't debate whether we should be having them, we just accept that we do. And then we attend to them and see how we can make them better. When it comes to emotional pain, we can't, should, or reason our way out of it any more than we can convince ourselves not to have a headache or a sore muscle. And being upset with ourselves for being upset only makes us feel worse. Another thing that can complicate the emotional healing process is that sometimes during a very stressful or challenging situation, our brain will buffer us from the full physical or emotional toll that it is having on us at the time. So, for example, this enables athletes to push their body to its limits during a competition. And it may not be until after they are done or even the next day that they experience the soreness from the strain they have endured. Knowing this, they often develop and implement specific regimens to help them physically recover from what they have put their body through. Similarly, during times of significant stress, we will likely not fully grasp the impact the situation is having on us until things have settled down and the stressor has been resolved. Then all of the emotions that we are not aware of at the time catch up to us. And it can feel very confusing and disturbing and overwhelming to find ourselves feeling sad or angry or anxious right when we are hoping to catch our breath and breathe a sigh of relief that the situation has improved. And rather than taking the time to facilitate emotional recovery from all that we have just gone through, we try to go right back to our regular routine and normal life. That can end up being just as harmful to our healing as it would be to try to run a marathon right after getting the cast off of a broken leg. Now, we humans are not known for our patience, and that applies to the healing process as well. Sometimes we can get so caught up in just wanting the pain to stop that we look for the quick fix that gives us relief but doesn't necessarily help us heal. A pain pill or cortisone shot can reduce the pain of a physical injury, but the injury itself doesn't get better by virtue of those interventions. And if we don't take care of the affected area, we run the risk of injuring ourselves further and slowing down the healing process. The same is true for our emotional hurts. We have all kinds of things we look to block or suppress our challenging feelings, and while that can give us a temporary break from the pain, it does nothing to improve the source of the pain and can end up only prolonging the agony. When people ask me how long they need to give care and attention to their emotional hurts, my answer is always the same: until it doesn't hurt anymore. If you cut your finger, you don't expect to peel back the Band-Aid the next day and find that it is all better. I frequently hear people being frustrated with themselves and the process when they are still experiencing emotional distress longer than they want to or think they should be. I worked with a woman once who had lost her husband after 50 years of marriage. She came to me for counseling 6 months later after people in her life expressed surprise that she still missed him so much. This made her feel as though there was something wrong with her, that she was experiencing so much sadness about this loss. The best thing I did for her was validate her grief and tell her it was completely normal, natural, and appropriate for her to feel as she did after losing someone she had lived with and loved for 50 years. There is no right timetable or time frame within which grief or any other emotional reaction is supposed to resolve. Healing happens in its own time and way, and our responses to the healing process can either thwart it or support it. When we don't receive adequate support for our emotional injuries to successfully heal, or when we don't take the time to attend to our hurt feelings, then we essentially end up emotionally limping through life, accommodating and compensating for the pain that we continue to experience. This might include guarding ourselves with other people, not daring open our hearts because the risk of additional hurt seems too great. We might find ourselves feeling easily hurt or offended in interactions with others because these touch old hurts that are still sensitive and sore. We often make the mistake of making that painful experience be about the other person rather than recognizing the painful interaction with them as an opportunity to attend to and address that unhealed aspect of ourselves. All of these experiences can cause us to feel poorly about ourselves and as though there is something wrong with us. So how can we support rather than thwart emotional healing? I'm going to use an easy acronym to lay out the steps to help you heal. HEAL. H is for heed. Heed the pain. Whether it's a check engine light in your car, the fire alarm at your office, or a blinking yellow caution light on the road, we are taught to heed warning signals because they are alerting us in some way. All pain, whether physical or emotional, is a signal that there is something going on. Its goal is to get us to pay attention. Just as physical sensations and experiences give us a greater awareness of and understanding of our bodies, feelings give us an understanding of what affects us emotionally. Now, our reflex is to resist difficult feelings because we are wired to avoid pain. But the pain is trying to show us where healing is needed. When we try to ignore, suppress, or distract ourselves from our challenging feelings, we are missing an opportunity to take care of something that has been bothering us. And emotions that are not acknowledged and attended to will only resurface until they reach an intensity that we can no longer ignore. So heed the signal that is being sent to you and appreciate that something important is being brought to your attention. Then take interest in finding out what it's about. E is for express. Express the feeling. Each of our bodies has all kinds of ways to expel what it doesn't need. We exhale, we cough, we bleed, our noses run, we sneeze, we eliminate, menstruate, perspire. Every one of these serves a vital purpose. And guess what? So does crying. It's no accident that we have tear ducts, and that's not just for when we get something in our eye. None of us would dream of trying to stop those other physiological functions from occurring, and we wouldn't be successful even if we tried. How in the world do we think it could possibly be healthy for us not to cry? Emotions need to be expressed, and when we allow ourselves the release of emotions that our body is calling for, we often experience immediate relief. That doesn't make the source of our distress instantly go away, just as stopping the bleeding doesn't make the cut all better. But it is a starting point for discharging the emotional energy from our bodies rather than keeping it all inside. Crying is not the only way to express emotion. Talking and writing can also help release and relieve the challenging feeling you are having. But you have to feel it to heal it. So stop and spend some time with whatever the feeling is. Connect to your heart so your brain doesn't take over and try to get you to revert back to those old reflexes and thought processes that you've relied on in the past to get away from the emotions. Ask yourself what's going on and really try to just feel what you feel without getting caught up in judgment or explanation. Have curiosity about what those feelings are trying to tell you. It can help to write down whatever comes to you. Try to write it as I am feeling sad, angry, scared, etc., rather than I am sad, angry, scared. You are having feelings, you are not the feelings. Saying I am defines you by the feeling. Saying I am feeling acknowledges emotions as an experience rather than as who you are. A is for attend. Attend to the hurt. Just as you need to feel it to heal it, so too it is necessary to attend in order to mend. As you discern what the feeling is, consider what you are needing in order to help with that feeling. Remember that emotions are best tended to with care and compassion, not logic and reason. If you are feeling lonely, you are needing connection. Can you respond to yourself with comfort, saying, I know you feel so lonely. I'm right here. Then think about who you may want to reach out to also help you feel loved and supported. If you are feeling sad, you may need to grieve. Let yourself cry and support yourself through whatever the sadness is connected to. If you are missing someone that you love, talk to them out loud or in your head or on paper. Express how important to you they are and how much you wish you could be together. If you're experiencing anger, let yourself vent and get in touch with the hurt that is underneath it and provide comfort for yourself through that hurt. If you are feeling scared, focus on soothing and reassuring yourself. When we acknowledge and attend to our emotions, whatever they might be, rather than trying to push them away or ignore them, their intensity will subside. L is for let go. Emotions are energy and are meant to flow freely through and out of our bodies. But because of the temptation to avoid or suppress them and the reflex of our brain to take hold of feelings as problems to be solved, we often end up perpetuating rather than processing and releasing our emotional pain. After expressing and attending to the challenging emotions, doing some focused breathing can be a beneficial way to help you let them go. Whatever the emotion is, and wherever you may feel it in your body, imagine you are drawing it into your lungs as you inhale, then blowing it out with your breath as you exhale. Continue this until you no longer notice that sensation in your body. Then you may want to imagine peace or calm being drawn into you when you breathe in and traveling throughout your body as you breathe out. If you develop the habit of doing this whenever tough emotions arise, you will likely find that they respond more quickly and subside more easily over time. And you will develop the courage to face challenging feelings and the confidence to know that whatever they may be, you can help yourself get through them and truly make the pain go away. Take care and have a good week.